Hello, everyone. Dr. Alan Mandell here, and today I want to talk to you about something that most people get completely wrong when it comes to keeping their legs strong after 60. If you've been told, or if you believe, that you have to walk to rebuild the strength in your legs, I want to respectfully challenge that today. Because the truth, backed by exercise science, is that certain seated exercises can rebuild leg muscle, restore circulation, and improve your stability in ways that walking simply cannot match. Now, I know what some of you are thinking. Dr. Mandell, I can barely get up from the couch some mornings. Walking is painful. Standing for long periods wears me out. And that is exactly why I made this video, for you. Today I'm going to show you 3 seated exercises. You'll do them right here, in a sturdy chair, no standing required, no equipment, no gym membership. And before we're done, I'm going to show you one specific exercise, exercise number 3, that targets a muscle in your inner thigh and knee that even 30 minutes of walking doesn't fully activate. That one exercise alone can make a remarkable difference in how stable and strong your knees feel over the coming weeks. So stay with me. Let's start with the big picture, why this is happening to so many of us and what we can actually do about it. Here's what's going on inside your body after the age of 60, and I want you to understand this because once you understand it, these exercises will make perfect sense to you. First, there's a condition called sarcopenia. That's the medical term for the gradual age-related loss of muscle mass and muscle strength. And it doesn't discriminate. It affects all of us. Studies show we can lose anywhere from 3 to 5% of our muscle mass every decade after age 30, and that rate accelerates after 60. The legs, especially the quadriceps and the calf muscles, are among the first areas where this loss becomes noticeable. You notice it when getting up from a chair feels harder than it used to, when climbing stairs leaves you winded or shaky, when your legs feel heavy and tired even after short walks. That's sarcopenia at work. But here's the second piece. Venous return. Your heart pumps blood down to your legs with no problem. Gravity helps with that. The real challenge is getting that blood back up. Your leg muscles are supposed to act like a pump, contracting and releasing to push blood back up through your veins toward the heart. When your leg muscles become weak and inactive, that pump stops working efficiently. Blood pools in the lower legs. You get swelling around the ankles. You get that heavy, achy feeling. In more serious cases, reduced venous return is a contributing factor to deep vein problems. And the third piece is proprioception, your body's ability to sense where it is in space. The nerve endings in your leg muscles and joints send constant signals to your brain about your balance and position. As we age and as muscles weaken, those signals get weaker. That's why so many people over 60 feel unsteady on their feet. That's why falls become a concern. Now here's the good news, and I mean genuinely good news. All 3 of these problems, muscle loss, poor circulation, and reduced proprioception, can be significantly improved with targeted movement. And the beautiful thing, you don't have to stand to do it. The exercises I'm about to show you use principles called eccentric contraction and isometric loading, 2 of the most powerful tools in rehabilitation medicine. Eccentric contraction means the muscle works as it lengthens, not just as it shortens. Isometric loading means the muscle fires intensely without moving the joint. Both techniques have been shown in research to rebuild muscle fibers, restore neuromuscular signaling, and improve circulation, all from a seated position. Your chair is your gym today. Let's use it. The first exercise is called the seated leg press against resistance. Now, I want to explain to you why we're starting here, because this isn't a random choice. The movement pattern in this exercise, pressing the foot down into the floor while controlling the return, mimics the exact muscular action your legs use when you stand up from a chair. That is the single most important functional movement for maintaining your independence as you age. If you can stand up from a chair with confidence, you can navigate the world. The muscles we're targeting here are the quadriceps, the four large muscles across the front of your thigh, along with the hip flexors and the gluteal muscles at the back. These are your power muscles, your locomotion muscles, and they respond beautifully to this kind of training. Here's how we do it. Sit tall in your chair. I want your back straight but not rigid, relaxed, and upright. Both feet flat on the floor, hip width apart. Place your hands gently on your thighs or the sides of the chair for light support. Take a nice deep breath in. Now, press both feet firmly down into the floor, not lifting them, not moving them, just pressing. I want you to feel your thigh muscles engage, feel your glutes tighten slightly. Good. Now, while maintaining that press, slowly raise your heels off the floor, just the heels. Keep the balls of your feet planted. Hold that position for a full 3 seconds. Feel that burn in the front of your thigh? That's your quadriceps working exactly the way we want. Now, and this is the important part, lower your heels back down slowly. Take 3 to 4 seconds on the way down. That slow lowering is what we call the eccentric phase, and it is where the actual muscle rebuilding happens. Don't rush it. Control it all the way to the floor. That's 1 repetition. Let's do 12 of those, rest 30 seconds, and repeat for 3 sets total. Notice how I'm breathing throughout, exhaling on the press, inhaling on the way back down. Never hold your breath during exercise. Your cardiovascular system needs that oxygen. Now, a coaching tip from me to you. If you feel any discomfort in your knees during this exercise, reduce the intensity of the pressing. You should feel muscle effort, not joint pain. There is a difference, and your body knows it. If this feels too easy after a week or two, that's wonderful. That means it's working. You can progress by adding a light resistance band around your thighs. 3 sets, 12 repetitions, 30 seconds of rest between sets. Remember that slow, controlled lowering. This exercise alone, done consistently 5 days a week, will make getting out of your chair feel dramatically easier within 3 to 4 weeks. All right, exercise number 2, and this one has a special place in my heart because it addresses something that so many of my patients struggle with: swelling in the ankles, heaviness in the lower legs, that feeling like your feet are wrapped in tight socks even when they're not. This is the seated calf pump with toe lifts. And I want to share something fascinating with you before we begin. Your calf muscles, the gastrocnemius and the soleus,
are often called the body's second heart. And that's not poetic language, that's physiology. When your calf muscles contract and relax rhythmically, they physically squeeze the deep veins in your lower legs and push blood upward against gravity back toward the heart. Every step you take is essentially a calf pump in action.
But when walking is limited, when you're recovering from injury, when your balance makes walking unsafe, when arthritis makes every step painful, that pump stops, and the blood pools, and you swell. This exercise restores that pump without requiring a single step. We're also going to add toe lifts, lifting the front of the foot while the heel stays down to activate the tibialis anterior, the muscle running along the front of your shin. This muscle is critically important for preventing foot drop, for keeping your gait smooth, and for ankle stability. So we're working front and back of the lower leg in one elegant movement. Let's do it. Sit tall, feet flat on the floor. Now, raise both heels off the floor as high as you comfortably can. Good. Hold for 2 seconds at the top. Feel the back of your lower legs contracting. Now lower your heels slowly, take about 3 seconds, all the way back to the floor. Without pausing, now lift the front of your feet, toes and the ball of the foot off the floor, heels staying planted. Hold for 2 seconds. Feel the front of your shins working. Now lower back down. That heel raise, then toe lift, counts as one full cycle. We're going to do 15 to 20 of those cycles, rest, and do 2 to 3 sets total. Heels up, hold. Slowly down. Now toes up, hold. Slowly down. Beautiful. You'll feel a gentle warmth building in your calves and shins. That warmth is blood moving. That's circulation improving in real time. For those of you who have been told you're at risk for deep vein thrombosis, blood clots in the leg, this exercise is particularly important for you. Of course, always follow your doctor's specific guidance if you have an active clotting condition. But gentle calf pumping is one of the most widely recommended movements for promoting healthy venous return. My coaching tip for this exercise: slow the tempo down even further on the lowering phase. The slower you go, the more time under tension, and the greater the circulatory benefit. If you can do these while watching television in the evening, do it. Your legs will thank you in the morning. 2 to 3 sets, 15 to 20 repetitions. You can do these every single day without fatigue concerns. The calf muscles recover quickly and benefit from daily stimulation. Now, are you ready for exercise 3? Because this is the one I mentioned at the very beginning of this video, the one that targets a specific group of muscles that walking often cannot reach. Let me show you. This is exercise 3, and I want to take just a moment before we begin to explain the science behind it, because once you understand what's happening, you'll feel this exercise completely differently. Deep inside your quadriceps, the 4 muscles of your front thigh, there is one muscle that plays an outsized role in knee stability. It's called the vastus medialis oblique, or VMO. You might know it as the teardrop-shaped muscle just above and to the inside of your kneecap. When the VMO is strong, your kneecap tracks properly, your knee feels stable, and stair climbing feels controlled. When the VMO is weak, which happens to most people over 60, especially those who've reduced their activity, the kneecap can shift slightly off track. That's a major source of chronic knee pain and that grinding sensation many people feel. Here's the remarkable thing about the VMO. It is preferentially activated not during straight leg movements, but during movements that involve inward pressure at the knee. And walking, even brisk walking, simply doesn't provide that inward pressure in the right way. This exercise does, and it uses what's called isometric loading. The muscle fires at maximum intensity without any joint movement whatsoever, which makes it completely safe for people with arthritis, hip replacements, or significant knee pain. You'll need one prop for this exercise: a folded towel, a small pillow, even a rolled-up magazine. Anything you can hold firmly between your knees. Place your prop between your knees. Now sit tall, feet flat, back straight. Take a breath in. Now squeeze your knees together against that object. Not a gentle squeeze. I want a firm, deliberate contraction. Hold that squeeze for 5 to 8 seconds. Really feel the muscles engaging on the inside of your thighs and just above your kneecap on the inner side. That inner burn, that's your VMO firing. That's exactly what we want. Now release slowly. Take a breath. Then squeeze again. 1, 2, 3, 4, 5. Good. Release, breathe, and again. We're going to do 10 repetitions of that 5 to 8 second hold in 3 sets total. Now, remember when I told you at the beginning of this video that exercise 3 activates a muscle that even 30 minutes of walking doesn't fully reach? This is that moment. The VMO is notoriously difficult to target through linear movement. Isometric adduction, pressing inward, is one of the most direct ways to recruit it. Physical therapists use this exact technique in post-surgical knee rehabilitation, and you can do it right here in your living room. My coaching tip: don't just squeeze your knees. Think about pulling your inner thighs up and inward simultaneously. That mental cue activates even more of the VMO fibers. The mind-muscle connection is real, and it matters. I also want to point out something else happening during this exercise. Your adductor muscles, the inner thigh muscles, are also working hard. Strong adductors improve your ability to stabilize your pelvis when you walk, which directly reduces hip and lower back discomfort. So while you're building your VMO, you're also reinforcing the entire inner leg and pelvis support system. 3 sets, 10 repetitions. Hold each squeeze for 5 to 8 seconds. This exercise will humble you the first time you do it. That's completely normal. Start with 5-second holds and build to 8 over the first week. You will feel a difference in your knee stability. Many people notice it within the first week of consistent practice. All right, you now have 3 exercises. Let me pull them together into a simple routine you can actually follow. Here's how your week looks. 5 days a week, Monday through Friday, works beautifully, or choose any 5 days. Take the weekends for active rest, gentle walking if you can, or simply going about your day. Your session will take approximately 10 minutes. That's it, 10 minutes. You can do it in the morning before breakfast, during a commercial break in the evening, right after lunch, whenever fits your life. The sequence. Start with exercise 1, the seated leg press. 3 sets of 12 repetitions. This wakes up your quadriceps and gets blood flowing to the major muscle groups. Move to exercise 2, the calf pump with toe lifts. 2 to 3 sets of 15 to 20 repetitions. This keeps your circulation active and prevents the blood from settling in your lower legs. Finish with exercise 3, the isometric squeeze. 3 sets of 10 repetitions. holding each squeeze for 5 to 8 seconds. This is your precision work, targeting the VMO and adductors, reinforcing your knee and hip stability. No rest needed between exercises unless you feel you need it. These are gentle enough to flow together. But always listen to your body. If one day you feel tired or off, it's perfectly fine to do just 1 or 2 of the exercises rather than none. When can you expect to feel a difference? Here's an honest timeline based on what I've seen with patients and what the research supports. In the first 1 to 2 weeks, many people notice reduced ankle swelling, especially if they do the calf pumps in the evening. Legs feel lighter, less of that heavy, waterlogged sensation at the end of the day. By weeks 3 and 4, you'll likely notice functional strength changes. Getting up from your chair feels less effortful. Climbing stairs feels more controlled. That wobbliness when you stand up quickly starts to diminish. By weeks 6 to 8, if you've been consistent, people around you may start to notice the difference before you do. Your gait changes. Your confidence on your feet changes. Now, I do need to be honest with you about one thing. These exercises are powerful tools, but they are not a replacement for your doctor's guidance. If you have cardiovascular conditions, if you've had recent surgery, if you take blood thinners, or have been diagnosed with deep vein thrombosis, please talk to your physician before beginning. Most of these exercises are gentle enough to be approved for nearly everyone, but your doctor knows your specific situation. Always check with your healthcare provider before starting any new exercise program. And if any exercise causes sharp pain, not muscle effort, but actual pain, stop immediately. We are building strength, not pushing through injury. I want to leave you with something I tell my patients all the time. Your legs want to be strong again. They were designed for it. The human body has an extraordinary capacity for recovery, even at 70, even at 80, even after years of reduced activity. What your muscles need is the right kind of signal, a reason to rebuild. Today, you've given them that reason. 3 exercises, 10 minutes a day, 5 days a week. That's the investment. And the return on that investment is being able to stand up from your chair with confidence, to walk to your mailbox without holding on to the wall, to play with your grandchildren on the floor and get back up without fear. That is worth 10 minutes of your day, every single day. Now, I have one small request before you go. If this video helped you, if it gave you something useful, something you can actually use today, please hit the like button right now. It takes 1 second and it helps this channel reach more people who need this information. And subscribe to Healthy Aging America if you haven't already, so you never miss a new video. Every week we're here with practical, science-based information to help you move better, feel stronger, and live with more vitality at every age. I'd also love to hear from you. Drop a comment below and tell me, which of the 3 exercises did you feel the most? Was it the leg press, the calf pump, or the isometric squeeze? I read every single comment, and your experiences help me make better videos for this community. And if you know someone, a friend, a neighbor, a family member, who is struggling with weak legs, poor circulation, or knee instability, please share this video with them. You might be giving someone something they've been searching for. Take care of yourself, stay consistent, and I will see you in the next video. This is Dr. Alan Mandell reminding you, motion is medicine.